An Ontario family is going public today after their brother died from a toxic response to a commonly prescribed chemotherapy drug. They say better screening could have prevented his death. Rosa Marcatelli this morning has the story and looks into who else is most at risk.
It's a proven chemo drug that's been prescribed for decades in Canada. So when Anil Kapoor was given Fluorouracil, known as 5-FU, he and his family were hopeful the treatment would buy him several more years. The 58-year-old had stage 4 colon cancer. But only 3 weeks after Kapoor's first and only dose, he died. Killed not by the cancer, but by the chemotherapy drug that was supposed to help save his life, according to doctors.
It makes me very upset. I mean, my brother's death was very preventable. Patients need to be told that this is what could happen.
What his doctors didn't know is Kapoor had something in his DNA, a genetic variant, that makes the drug toxic to his system. It's unclear how many Canadians have similar variants.
These people are dying as a result of the therapy and not dying as a result of their cancer progression, which makes this a very important issue for us to tackle.
Some provinces like Quebec and Ontario, where Kapoor lived, routinely pre-screen cancer patients for DNA differences that can make 5-FU toxic. But they only test for what are considered the 4 most common ones, and there are a lot more. Here's the thing. Experts say when decisions were made on which variants are most common, they were based on medical studies which mostly neglected racialized populations.
When we start looking at individuals with ancestry outside of even Northern and Western Europe, we know less and less about which of the variants that they may carry will actually predispose them to an increased risk of toxicity to the drug.
It's unknown if Anil Kapoor's genetic variant is more common in people of South Asian ancestry. So why don't provinces do wider tests? Some say there isn't enough research to say they should. But BC does just that. Instead of testing for 4 genetic variants, it pre-screens for 6 after studying this drug's impact on Vancouver's diverse population.
I just feel like we were robbed of time together. I feel like he was robbed of years and possibly the rest of his life.
Anil Kapoor was a doctor, and so are his 2 younger brothers. The family is now getting tested to find out if they have the same variant that led to his lethal reaction to 5-FU. So far, they've confirmed his younger brother, Scott, does. Medical information that could have prolonged Anil's life. Rosa Marcatelli, CBC News, Calgary.